kids at home, and today we're helping you focus on their mental health. The CDC estimates that 20% of children in the U.S. experience a mental, behavioral, or developmental disorder, and parents can improve the likelihood that they'll succeed in work and relationships as adults. So joining our conversation today is Heather Hans, a licensed clinical social worker and psychotherapist. Good morning, Heather. Thanks for joining us.
Good morning, Natasha. Thanks so much for having me.
So we're talking about the mental health of our kids. Is there a parenting style that helps kids the most?
There is. Research has found that what's called an authoritative parenting style is linked with the highest mental health outcomes in kids throughout the world. It's unlike permissive parenting, which has very few rules and expectations, and it's also different than authoritarian parenting, where parents use threats and harsh punishments to try to control their kids. Instead, parents set limits, expectations, and structure in ways that are warm and sensitive and respectful.
That makes total sense. How else can parents improve their kids' mental health?
Well, first and foremost is to build a close relationship with them. Having a good relationship with parents is one of the strongest protective factors against mental health disorders. And parents can create that by being attuned to their child's verbal and nonverbal behavior and responding empathetically. So you want to mirror their internal state. So if they're excited, you get excited. Ask them questions about their feelings and activities and interests. And another thing to do is model mentally healthy behavior yourself. No one's perfect, but as best as parents can do, this is important because kids learn from their parents how to behave by the way their parents behave. So it's important for parents to examine how they feel about themselves, how they deal with difficult emotions, how well they take care of themselves, and how they view the world, because it all impacts their child's mental health. And a third technique is to teach them mindfulness techniques. Learning how to regulate emotions is a lifelong skill that empowers kids and reduces anxiety. So parents can have their kids place their hand or a stuffed animal on their belly and make sure that that rises when they take each breath rather than their chest. And that elicits a relaxation response in the body. You can also hug your child and sync your breathing together, which creates that attunement I was talking about for close relationships.
I love all the advice that you're giving, Heather. Another big part of this conversation is timing. So when should parents seek help for their child's mental health?
Well, if a parent notices that their child or their child's friend or neighbor is feeling sad for more than 2 weeks, or they have chronic headaches or stomach aches, changes in grades or sleeping and eating patterns, then it's best to reach out for help.
All right, Heather Hans, thank you so much. Appreciate you coming on the show.
Thank you so much. Have a great day.
You too.